Hello, my name is David Trimberger, and this is Molly Hall. We are going to be trying to complete attempt number 5 my peer-to-peer attempt number 5 for trauma adult physical assessment. So what am I being dispatched to?
25-year-old female with severe leg pain.
Severe leg pain, okay. What is the credentials of my partner?
EMT.
Okay. Trying to get some demographics for the situation. What time of day is it?
6 p.m.
6 p.m. What's the weather like outside?
Sunny.
Sunny. And where am I being dispatched to?
College arena basketball court.
Okay. As I'm kind of getting on scene, what is the position my patient is sitting in?
Patient supine on the locker room floor.
Okay. Do I notice any signs of bleeding or anything?
No.
Okay. So as I am assessing my patient, I'm going to go ahead and walk in, so be advised my scene safe.
Yep.
Okay. Does my patient look at me as I approach her?
Yes.
Okay. As I am talking with my patient, I'm going to say, "Hi, my name is David. I'm with Whatever EMS. What's going on today?"
I was playing basketball and I was hit really hard and heard a pop in my leg and now I can't bend it.
Well, I'm really sorry that happened. We'll try and get you to the hospital real quick, but I got to ask you a couple questions before we get to the ambulance. Do you know where you're at right now?
Yeah, I'm at my college.
You're at your college? Do you know what time of day is it?
It's evening.
Evening? Okay, do you know what the date is?
July 5th.
July 5th. All right, do you know who our president is?
Trump.
Trump. And then if you had 4 quarters, how much money would you have?
$1.
$1? Okay. Would you mind opening up your mouth for me? I'm going to look in your mouth. Okay, then I'm going to be assessing the airway. Is the airway clear?
Yep.
Okay, I'm also going to be assessing for a breathing pattern. Is her breathing pattern normal?
Normal.
Okay, I'm also going to be checking for a carotid pulse. Is there one present?
Normal.
Normal. Okay. Do I notice any other signs of obvious deformities or bleeding other than to the one leg?
No.
Okay, so I'm going to try and get her out of the environment. So, alrighty, man. Well, I definitely think you need to be going to the hospital. Is there a particular hospital you want to go to?
Okay.
Integris? Okay, we can definitely do that for you. So we're going to try and be as gentle as we can. We're going to put you on a stretcher and get you to the back of the ambulance. Is that okay?
Sounds good.
All right. So as we get to the back of the ambulance, I'm going to be doing 3 things kind of at the same time. So I'm going to be starting off asking my partner to go ahead and connect them to a monitor. So I'm going to be assessing for a heart rate, blood pressure, respiratory rate, SpO2, blood glucose, and go ahead and put them on a 4 lead. And then I'm going to be doing a sample history as well as a head-to-toe rapid assessment. So starting off with the vital signs, what is her heart rate?
78.
78. What's her respiratory rate?
16.
16. What's her blood pressure?
120/80.
Okay, and then what's their blood glucose?
85.
85. And then what does their 4 lead show?
Normal sinus.
Okay, and then if I were to ask her to rate her pain on a scale from 1 to 10, 1 being no pain at all, 10 being worst pain they've ever felt, how would they rate it?
8 out of 10.
8 out of 10. Does the pain just stay in one spot? Does it move anywhere, or
What's all in the leg?
all in your leg? If how would you describe the pain?
Burning.
Burning? Okay. Then I'm also going to be doing a sample history and a head-to-toe at the same time. So starting off with the sample history, are you allergic to anything?
Nope.
Do you take any medications?
No.
When's the last time you ate or drank anything?
Like 2 hours ago.
2 hours ago? Okay. And then you said that you were just playing basketball when somebody ran into you?
Mm-hmm.
Okay. Next, I'll be doing my rapid trauma assessment. So starting from the head, I'm going to be assessing for any signs of decap, BTLS. Is there anything to the scalp?
No.
Okay, going down to the eyes, is there a pupillary reaction?
Yep.
Okay. Is the nose in line?
Yep.
Okay, is there any sign of battles? Is there any battle signs or drainage coming out of the ears?
No.
So oral cavity intact?
Yep.
Okay. I'm also going to be checking to see their throat, to see if there's any signs of JVD or tracheal deviation.
No.
No? Okay. I'm also going to come down to their chest, checking for decap BTLS. So I'm going to see if the sternum is also intact and if the rib cage is intact.
Yep.
Okay, I'm going to listen to lung sounds in all fields. Does she have clear equal bilateral lung sounds?
Mm-hmm.
Okay. I'm also going to be palpating the 4 quadrants of her abdomen. Is her abdomen clear?
Yep.
Okay, I'm going to come over and check the stability of the pelvis. Is her pelvis clear?
Yep.
Okay, then I'm going to check her back. Is her back clear?
Yep.
yet again assessing for any signs of DCAP ATLS. Then I'm going to be checking for her extremities for sensory motor and pulse motor sensory for all 4 extremities, as well as any signs of DCAP ATLS.
Normal except for left leg.
Except for the left leg. Okay. So due to her saying she has 8 out of 10 pain and she has obvious deformity to the leg, I'm going to recommend that we try and give a pain medication such as fentanyl. So I'm going to start asking her a couple questions beforehand. So I'm going to say, excuse me, ma'am, have you ever taken any medication such as like fentanyl or morphine?
Yes.
Yes? Okay. Well, we're going to be giving you 50 micrograms of fentanyl, but we are going to have to be giving it through an IV. Is that okay?
Mm-hmm.
Okay. A couple other questions. Do you have any chance of the possibility of being pregnant?
Nope.
Okay. So before we start the IV, I want to go ahead and stabilize the extremity. So I'm going to ask my partner to hold inline stabilization. I'm going to come over and stabilize the extremity. After the extremity is stabilized, I'm going to reassess pulse motor sensory. Then I'm going to come over and I will start an 18 gauge IV in the left AC. Do I succeed on my IV?
Yep.
Okay, I'm going to then administer my 50 micrograms of fentanyl, and then I'm also going to put my patient on capnography just in case. I'm going to do that to detect any signs of hypoventilation. Then after I have assessed my patient, I'm going to keep reassessing my patient every 5 to 10 minutes en route to the hospital. I'm going to give report to the hospital and then continue to monitor my patient after the report. So is there any change in patient condition en route to the hospital?
No.
Okay, then I am going to give patient report at patient bedside and then transfer patient care to nursing staff. Thank you.